Okay, here we go, talking about respiratory anatomy with our models. I'll start with this one. From this model, we're able to see the nasal conchae. So you may remember from A&P1, can't forget about that stuff, with the bone chapter. The ethmoid bone, which sits behind the nose, has these folds, and those folds increase surface area and allow for more cilia and more ability to filter incoming air. On this model, lowercase letters A, B, and C are in order superior nasal conchae, or concha, superior nasal concha, middle nasal concha, inferior nasal concha. In between these folds are the meatises. So you'll see on your sheet superior meatus, kind of that little depression in between, superior meatus, middle meatus, inferior meatus. All right? On this model, I could also ask you about the pharynx. Okay? So the pharynx, as we know, air comes in through the nose and the nasal cavity and then into the pharynx. From the pharynx, it goes into the trachea. The pharynx has three regions. The uppermost region between my fingers here is the nasopharynx. Then we have the oropharynx, which is right across from the mouth. The oropharynx is the only region that is shared between the digestive and respiratory tract. And then between my fingers here is the laryngopharynx. So nasopharynx, oropharynx, and laryngopharynx. We can also see on this picture the epiglottis. The epiglottis is a piece of cartilage. When we swallow, that piece of cartilage flops down to block off the trachea because we want the incoming food to go down the esophagus, not the trachea. Other things we can see. On your sheet, you'll see tonsils. That is something that I would probably ask you on a picture. It's just easier to see. All right. Next thing, let's look at, we have this smaller pharynx and trachea model, or this big scary one. All right, if we look at this one, we can see the thyroid cartilage, otherwise known as the Adam's apple, thyroid cartilage. The next one down is the cricoid cartilage. Thyroid cartilage, cricoid cartilage. These try and show you the larynx and the vocal folds and the true vocal cords. I would ask that on a picture. Same thing here. This is just bigger, thyroid cartilage. Next one down is the cricoid cartilage. This is, of course, the hyoid bone. All right. As we work our way down, it's enough to see in my face. As we work our way down from the nasal cavity, the pharynx, the larynx, and then we have the trachea. Okay, trachea has these C-shaped cartilaginous rings. When I flip this over, the cartilage doesn't go around the whole thing. Running along the back is the trachealis muscle. Okay, C-shaped cartilage rings for the trachea. Let me make sure I'm following everything we need to know. The carina, right where the trachea splits off into the right and left primary bronchi, this last piece of cartilage of the trachea is actually elevated. You really can't see it here. It's not shown that well. But if I were to ask you, what is the elevated piece? Here. The elevation of the tracheal cartilage right before it splits into the right and left primary bronchi is called the carina. Then we have bronchi, or a bronchus is singular. So we have the right primary bronchus, left primary bronchus. Then they split. So this was primary. Then we have the secondary bronchi, and then tertiary are the colored ones. Primary bronchus, secondary bronchus, tertiary bronchus. You'll see other examples of models here. So this also shows our C-shaped cartilaginous rings for the trachea. On the back, of course, is the trachealis muscle. The carina, the elevated piece of cartilage right before it splits. And then we have primary bronchi, or bronchus, secondary bronchus, tertiary bronchus, the colored ones. All right. Other models we have would be the whole lung. All right. So on this one, we can see the whole lungs. We know that the right lung has 3 lobes. Yep. 1, 2, 3. 1, 2, 3. Upper, middle, lower. The left lung only has 2, upper and lower. That's because the heart comes more into the left side of the lung, so it's a little bit smaller. We can take these off. Perhaps I could ask you about the trachea or the carina or the primary bronchi, secondary bronchi, tertiary bronchi. All right? There's also this model, which I suppose is pretty similar, right? So we can see the lungs here. Left one only has 2 lobes. The right one does have 3, even though it's not shown. We can see other parts here, the pharynx, nasopharynx, oropharynx, laryngopharynx, trachea, primary bronchi, secondary bronchi, tertiary bronchi. Now, after the bronchi, it'll eventually split into bronchioles, but those are better asked on a picture. So review from lecture the order. It's primary bronchi, secondary bronchi, tertiary bronchi. Then we have bronchioles. Then we have terminal bronchioles, respiratory bronchioles, alveoli. Memorize the order. The bronchioles we can't see on here because they're microscopic. Remember, the bronchioles are what have the ability to constrict and dilate to regulate flow of air. Memorize the order. On the models, we can only see primary bronchi, secondary bronchi, tertiary bronchi. I can also ask you the bronchioles on a picture. Memorize the order. So coming from the tertiary bronchi, then we have bronchioles, terminal bronchioles, respiratory bronchioles, alveoli. On this side of the model, they're showing you the alveoli, and if we work our way back up, we could see that this would be the respiratory bronchiole, and this would be the terminal bronchiole. Alveoli, we can just see the alveolar sacs. Okay. Last thing I want to show you is I could have a poster on here, so you'll see this in the laboratory. The thing I want to point to is at the very bottom. If you look at this microscopic view of an alveolar sac of the alveoli, we'll see that we can see the type 1 cells and type 2 cells. The type 1 are the squamous or alveolar cells. Type 2 are the great cells. 1 is flat, because I may cover up the Roman numeral. 1 is flat, 2 is round and circular. All right? Good luck with everything.